So sometimes these patients are at home or on the floor, not in the ICU, and they have a dramatic variceal bleed where a blood vessel pops and they literally drown in their own secretions before we are able to help them and save them. This bleeding leads to lots of blood loss, and we are left transfusing these patients. Sometimes they go into something like disseminated intravascular coagulation, causing even more bleeding. So the gastroenterologists, if they're able, they go in and put bands, like they basically stop the bleeding in these varices. But oftentimes it happens time and time again. We fix them, we discharge them, they go home, they come back with the same thing. And as I see, you talked about hepatic encephalopathy, which is often caused by the toxins in their bloodstreams that are not able to be filtered by the non-functional liver at this point, and or infections. So these patients oftentimes are losing consciousness. They can also go into kidney failure, and it is difficult oftentimes to dialyze these patients because their blood pressure is already hanging on the low side due to their liver and not having enough protein that is made by the liver. They're also very prone to infections because they have a poor immune system. But overall, when you see a patient with end stage liver disease, they just don't look well. Their skin color is often yellow, they're bloated with too much fluid. Like I said, in and out of consciousness, they're prone to infection, and just an overall unhealthy picture. And what we see often that kills them is infection and these massive GI bleeds and, multi organ failure from their liver disease. So it's overall a chronic illness where they're in and out of the hospital with the same symptoms over and over again with that actual definitive treatment unless they get a transplant.